Are you struggling with your baby's teething phase? It's a common challenge, this journey of tiny tooth buds piercing through those soft, tender gums. It's a rite of passage for every child, and indeed a test of patience for every new parent. Sleepless nights, endless crying, excessive drooling, and a general sense of discomfort can turn your world upside down. But fear not, you're not alone in this. If this sounds like something you're dealing with, stay tuned. Together, we'll navigate through this teething turmoil. First, understand that teething is a normal part of a baby's development. This process typically starts when a baby is between 4 to 7 months old. Teething is when a baby's teeth or milk teeth begin to emerge through the gums. Now every baby is unique, and so is their teething timeline. Some may get their first tooth as early as 3 months, while others might not have a pearly white in sight until their first birthday. So don't fret if your baby's teething schedule doesn't match the norm. As for the symptoms, well, they're pretty telltale. Your little one might start drooling more than usual. They could become fussier, especially during the night, and you might notice a newfound fondness for chewing on just about anything, from toys to your fingers. The symptoms aren't always pleasant, but remember, they're a sign that your baby is growing and developing. Recognizing these signs can help you better prepare for and manage this phase. Now that we've identified the signs of teething, let's move on to some practical tips to soothe your little one. Every baby is unique, and so is their teething experience. Some might breeze through it with a sunny smile, while others might have a bit of a rough ride. But fret not, there are several tried and tested methods that can help make this journey a little less bumpy. Let's start with offering a chilled teething ring. The cold sensation can numb the gums and provide relief, but make sure it's chilled, not frozen. A frozen ring might be too hard for your baby's tender gums. Next, nothing beats the good old-fashioned finger rub. With clean hands, gently rub or massage your baby's gums for a few minutes. The pressure can ease your baby's discomfort. Drooling is a common side effect of teething and can lead to skin irritation. Keeping your baby's face clean and dry can help prevent rashes. Use a soft cloth to gently wipe away the drool and apply a mild moisturizer to keep the skin hydrated. Now, let's talk about what to avoid. You might have seen teething tablets and gels in stores, but it's best to steer clear of these. The Food and Drug Administration has warned against using them due to potential health risks. Some contain an ingredient called belladonna, which can be harmful to your baby. Instead, if you're considering a pain reliever, always consult your pediatrician first. Over-the-counter medication should be used only under the guidance of a healthcare professional. And remember, patience is key. Teething is a natural process that every baby goes through. It might be a bit of a roller coaster ride, but it's also a milestone, a sign of growth and development. Remember, every baby is different, so what works for one might not work for another. So keep trying different strategies until you find the one that suits your baby the best. A little bit of trial and error, a whole lot of love, and you'll both get through this. While teething is a normal process, there are times when you should seek medical attention. We all know that teething can make a baby fussy, but if your little one seems unusually uncomfortable or distressed, it may be time to consult a healthcare professional. Likewise, if your baby develops a fever, it could be a sign of an underlying condition unrelated to teething. Teething itself does not cause a high temperature. So if your baby seems warm to the touch, it's best to seek medical advice. Diarrhea is another symptom that shouldn't be ignored. It's not a typical side effect of teething and could be an indication of something more serious. Lastly, if your baby refuses to eat or drink or has trouble sleeping despite your best soothing efforts, these could be signs that something else is going on. Never hesitate to reach out to a healthcare professional if you're concerned about your baby's health. In conclusion, caring for a teething baby can be challenging, but with the right knowledge and tools, you can navigate this phase with confidence. Let's recap. We've learned to recognize the signs of teething, explored practical tips for soothing your little one, and discussed when it's time to seek medical help. It's all about being prepared, patient, and proactive. Remember, you're doing a great job, and this teething phase won't last forever. Hang in there, parents.